Good morning, good afternoon, or good evening, depending upon which time of day you're coming to participate in our pain medicine fellowship application process. My name is Dr. Lubenow. I'm section chair for the section of pain medicine and program director for the pain medicine fellowship training program. And we are meeting here in this virtual environment today because of the COVID pandemic that the nation has been dealing with. Even though we can't meet individually, we want to be able to maintain this social distancing in order to keep everybody safe.
As you come to interview with us for the Pain Fellowship at the Department of Anesthesiology at Rush University, we have a unique program that has lasted and been engraved into the system for several years. Welcome you all to this interview process.
We are a full-fledged interventional pain fellowship program that offers trainees the exposure to do procedures with the help of fluoroscopy and now with ultrasound. So there are not many fellowship training programs that offer the full spectrum of training that you can get that we offer at Rush University.
The things that make our pain medicine fellowship training program unique and different, distinct from other pain fellowship training programs, is that we have a heavy focus on the neuromodulation techniques of spinal cord stimulation, DRG stimulation, intrathecal drug delivery, and we start this with a separate weekend courses that began right away in the August, September, October timeframe.
If you're looking for a program that is focused on teamwork and getting a lot of work done in an efficient manner, this is the place to learn how to do it.
The diversity of complex cases that the fellowship offers. We also have a clinical site in the community at Rush Oak Park Hospital, and then a third center in Westchester and Oak Brook, which offers, again, more of a simplistic, more community-based practice. So the fellows get a whole range of patients to see, from the simple ones that are fairly straightforward to the more complex and tertiary patients that they get to see and manage at Rush University Medical Center.
I was a Rush Pain Fellow here 4 years ago. Choosing Rush was a very easy choice for me for many reasons. One, we work with some of the best physicians who have been hosting some of the most major studies out there. Two, we have some of the best technology and use some of the best devices out there in all different ranges that are available today.
Hi, my name is Hima. I'm one of the pain fellows at Rush. I'm comfortable being a Rush pain fellow. I'm comfortable doing my procedures now. I have very good surgical skills, which I didn't have before.
Coming here to Rush University was an experience. You obviously want to impress your attendings because you're working with some of the greats of the industry. But soon after you start, that all goes away. Their expectations remain high, which is why you'll be an incredible pain physician coming out of Rush University. But they take you under their wing and they point out aspects of improvement. So the feedback is constantly there.
We have a number of different training events that we have on Tuesday evenings, because there's more information that we can teach you just in the day-to-day lectures or the day-to-day experience in the operating rooms. We usually have these at some of the restaurants that are in the greater metropolitan Chicago area, and this gives us a chance to let me introduce you to different parts of Chicago so that you see that we can have some fun outside work, but also in a educational environment so that you can see what life is like outside the usual typical day-to-day workload of a pain fellow.
When people ask me what are the things that I really think are the pluses of this program, and there's obvious things like there's the depth of experience, there's the breadth of the procedures, the clinical volume we do, but really it's the one-on-one mentoring. We are, in spite of our relatively large volume and busy practice, we are a relatively tight-knit community. There's 5 physicians, soon to be 6, and only 5 fellows. I mean, that's a 1.25 faculty ratio to fellow ratio. And so that means you're always working with an attending all time, every day for 365 straight days of this fellowship. And there's a tremendous amount of learning that takes place just in that one-on-one interaction. And when you're doing that direct one-on-one learning, it's one of the best things about this job as far as I'm concerned. When you see an idea or a difficult concept click in a fellow's head, or them suddenly get the technical facility to put in a stimulator lead and be able to do a surgical closure without assistance, that's just one of the best things as an educator. And that's one of the things I think makes our fellowship stand out, and makes it unique, is that direct one-on-one supervision all the time.
The name of Rush Pain Center is very uniquely embedded in the globe in the area of pain management. We do consider the Rush Pain faculty as a family, and even though you will be a fellow and graduate, you will still and will always belong to the Rush Pain Center family. Thank you.